Welcome to Lesson 4 for staff responding on patient opinion for the first time. In this lesson, we will look at a story that is complementary. We will look at the style and the way we respond within our trust. You will have been sent a link to the story via a patient opinion email alert. This is the page that you need to see before you leave your reply. The top toolbar tells you that you're logged in. If you can't see the stripy toolbar, it means you're not logged in, and this is where you will log in. If you just see where my mouse is hovering now, this is where I would log out. If you move further down the screen, you'll see that there's a Manage Your Stories with 4 tabs telling you the status of stories. I'm going to click on this one here. This is a complementary story that has been left from the Special Needs Dental Services and the Community Dental Service. And what we're going to do is have a look at the posting and the response that has been left by the individual. We're now going to look at this posting in more detail. It's complementary, it says that the staff are amazing, and I could not wish for better care. On the right hand side of your screen, it'll tell you that it was published on the 13th of October, that it's not critical, how many times it's been viewed by public users, and it lets you know you can add your response to the story below. It then summarises the story, saying what's good and what could be improved. It also logs the activity, letting us know that 23 staff members have read this story to date and who patient opinion has told about this story, such as Health Watch or commissioners, for example. Underneath, there's another box which asks people to show their support. Anyone who reads this story can show their support by clicking on the box. Alternatively, they can leave their own story too. We're now going to look at how we reply to stories on patient opinion. This is a positive story, and it shows that the individual who's responded has taken the time to read the feedback and to thank them. That team will receive the feedback, and we know that staff teams like to receive feedback as it lets them know when they're doing a good job. At the bottom of the box, it will ask if this response has been helpful. That's not for staff to click yes or no, it's for the author of the story. So if the response is helpful, the author is encouraged to tell us yes or no. Underneath this is the option to reply again. So the author can reply again, or it may be that in some cases another staff member may want to add something and reply again. So occasionally you'll get stories with up to 3 or 4 responses, but it's usually 1. Underneath it will also ask if there's going to be a change from this story. There's a help box here showing why change matters. In this case, it's not at the moment. You can add we're planning a change or we've made a change. You're then asked to sign your response, and you get an option of signing it as yourself, your team, or on behalf of the trust. We know that people like to have a name when somebody replies to their story. After that, all you need to do is send your response and click here, and that's the end of the lesson.